Welcome to Team Gut Girls, the podcast for anyone who's ever unbuttoned their jeans at 10 a.m., mapped out every public washroom in a 10-kilometer radius, or wondered why one bite of food can ruin an entire day. We talk about bloating, constipation, diarrhea, reflux, nausea, abdominal pain, histamine chaos, and all the quiet gut symptoms you're told to just live with. Join naturopathic doctors Dr. Whitney Baxter, Dr. Christina Carew, and Dr. Dominique Vanier. Your gut is talking, and we're here to help you translate. You're with Team Gut Girls now. Let's dig in.
And before we dive in, just a quick note. This podcast is for educational and informational purposes only. It's not meant for medical advice and doesn't replace working with your own healthcare provider. We're sharing general information, not diagnosing or treating anyone. Please always talk with your physician or licensed healthcare practitioner prior to making changes to your health, medications, or supplements.
Welcome back. So today we're going to talk about mast cell activation, and this is a big one that we're seeing a lot of people talk about in relationship to perimenopause, because we're seeing all these people posting on your various favorite platforms about H1 and H2 blockers, how it's making their lives so much different. And it would be really interesting, I think, to talk about how mast cell activation affects bloating and why it's working with this hormonal component piece, because knowing why something works is just as important as having something work. So today we're going to talk about sort of people that may have felt that they're getting bloated from foods that used to feel like they were safe, or getting bloated without eating much at all, or feeling like anxious or itchy or heart racing or headaches that comes alongside of the bloating symptom. And so one of these sort of important pieces in the bloating cycle that maybe is less talked about is mast cell activation. Mast cell is different than mastocytosis. We'll just start with that. Mastocytosis is cancer, and that's often what your family doctor might be familiar with because of that's what they learned in med school. But what we're talking about today is a completely different situation that uses similar components of the cell. So you're not dying, you might just be reacting. So maybe we'll start off with like, what is mast cell activation and how do we even know that that's going on? And not everyone that has bloating has mast cell activation, but for some women, this may be an explanation of why nothing else has worked in men as well. And so this, for me in my practice, you guys may have some different experiences as well, shows up when people feel like their bloating shows up really or with things that maybe shouldn't cause bloating, like water, or that they get a lot of symptoms that come alongside of it, like feeling like heart racing or anxious, or really a lot of fear that comes up around it, because it's a bloating that isn't really related to digestion. It's actually more related to the immune system. And so it's more of an inflammation system. In the previous episode where we talked about disorders of gut-brain interaction, we talked about how inflammation and motility are really affected by the immune system. And so this is another piece of that component. And so this is more of an inflammatory bloating rather than gassy bloating. Okay. So why don't you guys have any mast cell patient stories that you want to share as a way to like get people kind of familiar with what we're talking about? The starting point today.
I have a few cases that have popped up where people like are presenting this way. It could be more subtle. And a couple of times they've just been on anti-inflammatories every day for years. That was the solution that fixed these like very hive-like or allergy type symptoms. So for example, like a patient of mine had hives that would show up all over her hands, and the doctor said, here's a solution, which worked, but that was years and years and years ago. And now since then, all of these other subtle things have started to pop up, like you've mentioned, flushing, anxiety, absolutely indigestion. So that's always a little bit of a clue.
Yeah, I've had
I've had like varying degrees of mast cell patients. And so the one that stands out is significant digestive issues. So we've had the bloating and the constipation, but a lot of the skin involvement too. So significant eczema, reactions to foods, not being able to have baths or showers, like there being a kind of temperature reaction when the weather gets warmer. This person has reacted where their symptoms have been exacerbated just because of the temperature outside. So we're seeing like you mentioned, Christine, this immune system overlap with digestion, and it's a bit messy.
I actually had a patient this morning who was one of the ones who had gone for a pelvic venous assessment. And in the stenting, it actually triggered her body into this crazy mast cell reaction. And so this morning we were talking about like, how do we calm down and reset the body? It's been weeks. But it basically created this like safety issue in her body where her body like hyper responded or hyper vigilant. And that's really what it's about. So mast cells are cells that are in the body and they're filled with all kinds of mediators. So histamine, prostaglandins, leukotrienes, cytokines. They're all things that cause different reactions in the body, and their job is to respond to threat. And so threat, maybe there's something like the surgery or a procedure, but it could also be like a dog barking. It could be eating strawberries. It might be having a glass of water. And so the threat is not determined by what we think is, a threat to ourselves. It's what our body sees as a threat to the system, because it's very much intertwined with the nervous system. And so if our nervous system is on edge, so anyone that feels burned out or has had a lot of stress, it's a little bit easier for the body to like escape and go into this sort of threat pattern. And sometimes we'll notice that. Like if you notice when you walk into a room and you kind of like get startled by someone coming in behind you, right? Or even like when you see them, you can see them and you're still startled. And that's a good indicator that your nervous system feels a little bit overreactive potentially. I used to work in a shared office with a guy named Anthony, and every time he walked in, I would like jump, and he was like, "This is also my office." And I was like, "Yes, I am aware." And so definitely being there. So these cells are in our gut, which is part of why we're getting a lot of these gut symptoms, but also in our skin, in our lungs, in our bladder. And so we have a handout that's going to be posted in the show notes that talks about all the different areas that cells can trigger in. And it's really wide ranging. And so it's everything from endocrine disorders like endometriosis or PCOS to things like having traditional allergies or skin symptoms, which we talked about earlier, and even things like headaches or stomach pain. And so it's not really super clear because it passes so many different parts of the body, what piece is this or not. And there's not great tests. And so that's part of the challenge, is that there are some blood tests that can tell us, or some criteria that say, well, this is what traditional mast cell activation syndrome is. The challenge is that a lot of those tests are only positive if someone's able to catch the blood in a flare and get it tested really quickly. And that's really unlikely current healthcare environment that's going to happen very easily. And so a lot of the treatments and a lot of the even diagnosis is really based on trial and error and understanding what's going on with them. In my practice, we see it a lot around people with complex chronic illness. So they have already this really overloaded bucket of other things that are going on. And this safety system, is the way that I like to describe it, is actually preventing them from getting better, because something that they might be very tolerant to, and they're suddenly having a reaction. And so often this email goes back to someone and says, "That's a really unusual reaction that you're actually having. However, this might give us an idea that this other thing is going on." And so to think about that if you're having an unusual reaction to something, or as a practitioner, if you're having a patient that's having an unusual reaction to something, this might be a piece to think about. And so one of the myths, I think, that fits into this bloating category around mast cells is like, I have food allergies and I'm sensitive to this food because it makes me bloated. And so this classically looks like someone who has a really short list of foods that feel safe. And sometimes even those foods that feel safe may still be causing triggers. And it's not a classic allergy. It's actually just an immune system that feels super overwhelmed. It's so like it's the child that, has seen someone a million times that has come to your house and then suddenly like freak out. We're just like, why are you freaking out? That's grandma. Right? Like, and so same kind of idea. It's just like maybe they're really tired that day. Maybe they have a nap. Maybe grandma is wearing kind of perfume that upset them. Like you're trying to keep thinking about that. And so, so one of the reasons that we talked earlier about sort of foods, healthy foods that might worsen bloating could be some of this like histamine component. And so if you think about those foods with your patients, what would those typically be, or are people telling you?
I always think it's like the tasty thing, charcuterie board,
Yes.
glass of wine, beer, leftovers, really talked a lot about, but that can release some histamine. And then in some like good healthy things too, avocado, spinach, kombucha is a big one. There's a lot of stuff going on in kombucha, everybody. There's the sugar. There's like, it's like for sure fermented yeast. Yeah. So yeah, that's where some histamine like things can show up.
And histamine is like one thing, but it's the thing that we kind of all understand, like what is histamine. And so I think that one's like nice one sometimes for people to get some like comprehension around it. A lot of initial treatments really do focus on histamine. It's kind of the more predominant one. So we thought about kind of like a sort of things that we might suspect. So blushing we talked about, and heat intolerance, itching and hives, anxiety. Some people say they feel like an internal buzzing sensation or heart palpitations, headaches and migraines. So we often will tell people to avoid some of these foods during migraines. It's actually kind of working. And it may be something that really changes from day to day. So today, everything feels like super overwhelmed, and tomorrow after a good night's sleep, it doesn't feel like anything's. So what else? So what are things that cells kind of cause beyond bloating? When we think about the disorders of gut-brain interaction and some of those things that we talked about earlier, what are some of the things that we want people to think about? And so like hypersensitivity, gut motility, fluid shifts, permeability, things like that. So increased intestinal permeability, like leaky gut, can be an indicator of mast cells. So things like gas, distension, bloating, food irritations. This is intestinal permeability. We have a show coming up on that. Is sometimes where we think some of these food allergen type testings might be showing up. Like, why are you running these things on your test? It can also be reasons why we're seeing things like true allergies, anaphylactic allergies. So intestinal permeability is one of the pieces where mast cell can actually loosen some of those tight junctions up and create more reactivity in the body.
It's interesting that one because it goes back to this paper that I was reading recently about the FODMAP diet. And as we know, MCAS patients really overlap with digestive issues. And so we can see patients come to us who've tried the low FODMAP diet and they're like, oh, I saw an improvement with the low FODMAP diet. So the low FODMAP diet, the most common diet for IBS, but it also lowers food allergens too. And so from like an allergic standpoint is like we may see an improvement in this intestinal permeability just because they've lowered their food allergens, which again kind of goes into the second point of altered gut motility. So we'll see what can be rapid transit or slow transit or back and forth, and that has to do with the shifts in gas and bloating, fermentation, pressure in the gut, those sorts of things.
Your constipation actually can be a piece of this puzzle.
Definitely.
Yeah. Kind of depends on what's going on in their system. Other triggers, it's overlapped with so many things. But we've also talked about this piece in our previous episode on disorders of gut-brain interaction is the visceral hypersensitivity. So like Christina, you mentioned, the system is in like alarm mode for some reason. So the nerves are just getting triggered and the gut and the brain are yelling at each other for some reason. And thus this can just make normal things going through the gut, like our gas and our food, which should be there. It's all moving through. It can feel more intense and bloat inappropriately or feel painful.
Yeah, and we talked about this pain disinhibition aspect too, which is where we feel this pain more inappropriately because the signals are essentially miswired. And another thing that occurs is this fluid shift and vascular changes. So we are, histamine is able to increase blood vessel permeability. So we can see abdominal swelling even without excess gas. So that can maybe speak to like the redness and the kind of the temperature issues that we discussed earlier.
Yeah, so really this is a bloating that is really about what you ate, but more about how your immune system reacted. And the symptoms are very variable. So it makes yourself kind of crazy trying to track everything and figure out where it's coming from. And you may notice the bloating, but you may also notice other. Like you might also be like, oh, whenever I get bloated, I get a headache or I get this skin irritation or I feel really hot. And so that can be helpful to kind of narrow down that this might be an area to look at. I had a woman last week that emailed me that tried a probiotic just in part of her treatment plan. It wasn't a thing that I suggested, but she had added it in and had a crazy mast cell reaction, but we couldn't figure out what was going on because she thought she was like allergic to the probiotic. And so in her reaction was like, it was very long standing. So it wasn't just like she reacted that day. It was like 2 weeks and she was still reacting. And so some of that also is that security system, right? Your body is sure, what happened. And it had this like really intense response and then is so fearful. We see this in kids, right? The kids fall off the bike and then they're really hesitant to get back on the bike again. And you're like, well, you're never going to fall off every time. Like you're going to fall off, but you're never going to fall off all the time. And so same kind of thing happens. Body is like we learn one thing and then we're like, oh, that thing's not safe, or I can't do that thing, or someone in my family thinks that whenever they drink Gatorade they get diarrhea. It wasn't that at all, but it was like it becomes this like pattern, becomes kind of aligned in your brain, and it's really hard to undo. And so certainly some of this can hopefully help your body to feel safer if everything isn't so overwhelmed. I would say in addition to like foods, there's lots of things that can cause reaction. This goes back to what we talked about in the beginning. Hormone fluctuations actually can cause lots of mast cell activation, and especially things like estrogen. So if we see people that are having endometriosis, we see patients that are having more estrogen symptoms because they're changing doses of their bioidentical hormones, or they're in this perimenopause stage. This actually can explain, and we'll see a lot of overlap between some of the symptoms that they're having, headaches and mood changes and brain fog, that may actually be related to the hormone changes or actually triggering other things in their nervous system, because we certainly know this patient population, as they're getting into the perimenopause stage, usually has like the sandwich generation, right? They have their parents they're looking after and their kids they're looking after and their job that they're trying to do. And they just feel super overwhelmed really easily. And so that nervous system overload becomes really easy to happen. And so some people by happy accident, because it's allergy season in much of the country right now, are taking antihistamine and they're like, wait a second, everything else got better. And so that's like one way that people are kind of finding out that maybe some of these things are more interrelated. Stress certainly can be a big trigger, infections. And in my practice, I see lots of people with environmental exposures, mold exposures, Lyme disease, anything where the body is like trying to keep something under control, in this outside, kind of challenge comes in, and that might just be literally drinking a glass of water. that your body just feels so overloaded that it creates this massive response for this like, and what that really is that these cells break open, all the contents spill out, and it causes this inflammation and sensitivity and all these symptoms to be exacerbated. And so the bloating may be coming from not even eating because of this.
It's interesting because it's like a bit of a domino effect, right? You end up seeing the nervous system then kind of permeate into sleep issues, and we need to sleep in order to have good digestion. Like our circadian rhythm is very intertwined with our gut health. And so we can see a bit of like a snowball effect happening because so many systems are involved.
Do we know why, or do researchers know why it continues to like go in the loop? You know what I mean? Like, why does this reactivation keep happening? Is there a certain trigger, or is it really multifactorial?
Yeah. Well, I think part of it is like, if we don't identify it as an issue, like sleeping, for instance, if we don't get good night rest the one night, the next night, if we're doing the same thing, we're watching TV, we get to bed late, we eat late, then we're not getting sleep the second night. And then it feels like it snowballs, right? There's people that come into our practices that say, I'm losing and slept in 2 weeks, or I've slept in 3 weeks. And so I think the same thing is true in these like allergy loops or in these histamine loops, is that you then become so fearful and questioning of everything else. You increase the stress, which increase the bucket load. And so now a little bit of something is like pushing the bucket over. It's no different than when you have a great night of sleep, like you're way more tolerant to the people around you, even though they haven't changed at all. It's just like, you're like, oh yeah, no, I don't feel as fragile as I maybe did the day before. Or during menstrual cycles, sometimes people will say like, I'm very mean, or I'm agitated, or my family doesn't want to talk to me. Same kind of idea, right? It's like that this system becomes so overwhelmed by all the things that are going on. And we live in an environment that's really stressful right now. Like, the world is crazy. And so add that into the stuff that's already happening in your body, and we're just seeing so much reactivity. So this sometimes, why I think this was important to talk about, is this can kind of look like SIBO, right, on paper. So it's like you're getting this delay, you're getting upper body bloating, you're getting rapid transit, you're getting this distension, you're getting urgency, you're getting constipation, diarrhea, but maybe your SIBO test was negative, or you've already treated it and it's still happening. You know, is this part of the nervous system's reaction? Because we know the nervous system plays a big role in the gut. And is mast cell degranulation causing this bloating, which is causing this like neuroimmune system? And so thinking about all our overlapping diagnoses, constipation, diarrhea, IBS, SIBO, and it's like these are maybe all intermixed. Just because you have one problem with your gut, like constipation, doesn't mean you couldn't have another thing that's layered into there. So as much as the traditional medical system, like one issue, one problem, one solution, you know, what we really see is probably less of that, is that a lot of things really do overlap, and the more information that we can get from our patients really helps us to narrow in on this piece of the problem. I would say, especially women, estrogen plays a huge role in this. And so worse around ovulation, worse before menstrual cycle, worse during perimenopause, worse during hormonal birth control, worse at times that when progesterone is highest, like pregnancy, that suddenly things may feel like that they improve. But it can also worsen things because now we have a foreign thing that's in our body that's also creating our nervous system to react. So not simple.
It's interesting. I'm sorry, I keep referring back to research, but of course we're all evidence-based here. So there is one supplement for endometriosis, on the topic of talking about estrogen and how this could potentially overlap with MCAS. So one supplement known as PEA, which is, I'm not even going to try to pronounce it because I always butcher it, but it's known as PEA for reducing pain in endometriosis. And there is generally a newer research paper that is now studying PEA in MCAS and digestive patients for decreasing pain. So it's pretty cool where we start seeing this convergence of conditions where they're responding basically to the same type of mechanism that the supplement is working on.
Which is why we're seeing the women responding in the perimenopause, like TikTok space, to the antihistamines because it's working on the same receptors.
So neat.
One problem can have multiple solutions, and one solution can solve multiple problems. Okay, so what else do we want to know about this? Certainly, the testing we talked about is sort of questionable at best. There are some tests for what's called trip days. Trip days, sometimes as a practitioner, if people are getting tons of symptoms, we do want to see that it's a normal or low number, just because that could be the genetic sort of markers for things that are sort of more complicated than just having immune system reaction. So we're thinking about mastocytosis or those cancer markers or even genetic disposition. But we shouldn't just rely on the labs, because certainly, as we can see, the pattern really fluctuates. And so a normal response in the lab doesn't mean that you're clear. Or, taking histamines out of your diet, like some of the foods Whitney mentioned earlier, doesn't always clear you, both from having symptoms, but also to say, oh, I took those histamines out and it didn't make any difference. Because remember, histamine is just one of the mediators that's released. And so it is a plentiful mediator, but not everyone is responding to them. So how, as a patient, can you help your practitioners figure out if this is going on for you? I would say certainly tracking symptoms, both symptoms that happen during the bloating and not bloating time. And during the bloating, if you also have other symptoms like flushing or heart palpitations or skin irritation or menstrual cycle. Certainly looking at hormonal timing and the impact of sleep and stress and other things that are going on. So if you're like, oh, I'm getting these reactions on days when I am very stressed out, or I got stuck in traffic, or these things also happen, that can tell us a little bit about how your system might be a little bit overloaded. And maybe, Dominique, do you want to talk about sort of how this relate to IBS? That's your jam.
Yeah. And there are, maybe I'll preface it with, some patients truly do have IBS, but we also can see literally the clinical diagnosis of IBS show up in other kind of more umbrella conditions, right? So patients with disorders of gut-brain interaction, yes, meet the diagnostic criteria for IBS. A lot of patients with MCAS meet the diagnostic criteria for IBS. And maybe the mechanisms for group 1 versus group 2 is just totally different, or there's more of a dominant mechanism. So it doesn't mean that the symptoms aren't real, but for some people that do get the diagnosis of IBS, it means we just don't know why they're having these symptoms. So when it comes to bloating, and let's say they have the diagnosis of IBS and this bloating is mast cell driven, we want to be thinking about several things like calming the immune reactivity, stabilizing mast cells. We're really just trying to calm the whole system, supporting that gut barrier function, like we talked about earlier, that intestinal hyperpermeability. So we are reacting to all these proteins. And we've got a bit of like a cytokine inflammatory storm happening. We want to slow that down or calm that down. We want to make sure we're focusing on motility, if motility is an issue, as in like the speed at which things are moving through the digestive system. We don't want them to be too slow or too fast. And then lastly, we definitely want to focus on regulating the nervous system. So like we've talked about in other episodes, it's really not just chasing that next food to help us feel better. It goes beyond that. And ideally, we're not cutting foods, because we're focusing on other areas.
Yeah, and bloating in this case can really help and improve without having these really aggressive interventions. It's actually kind of the opposite, right? It's about calming the system, not, destroying the system by adding in more and more antimicrobials or antibiotics or things along those lines. Whit, do you want to talk about how someone could talk to their practitioner about investigating this, or that might even be a piece of the puzzle?
Yeah. So just kind of, if you are experiencing, mast cell or like this overloaded system, sometimes like, yes, bloating might be a piece of your puzzle, but other things we've talked about too, like headaches, that can really take over your life. So sometimes that's the main chief complaint. I have headaches, I have migraines. So just kind of like track your symptoms, headaches around your cycle. What's your digestion like around your cycle? Are you noticing other allergy type symptoms that may be linked, like your itching, your hives? So just start to be more curious about your whole body. It can get a little complex, but tracking it down, old-fashioned pen and paper, using an app, these period-free apps like Flu, as an example, are great because you can often track a whole bunch of different things, and it can just really be like more pieces of the puzzle to bring to your practitioner. And even with the digestion piece alone, so we're really focused on bloating here, but if you're noticing it, it's not really correlating with a typical timeline of when you should bloat. It's not happening 90 minutes to 2 hours after you've eaten a meal once it hits like the intestine or the microbiome. So it might be mediated by something else like your immune system if it's happening more quickly. So tracking and timing is great for us.
And we built a questionnaire that you can download in the show notes by visiting our website, so team.girls.com. And in there's like some of these clues that you can kind of check off and test, so you don't have to try to breeze through this podcast and figure out all the things that we said.
And we also have episode 2, which is on SIBO. So we've crossed over like discussion about small intestinal bacterial overgrowth a few times in this episode. So feel free to listen to our SIBO one because that may make a little bit more sense.
I would say one of the big things in going to see a practitioner is be aware that lots of practitioners will have not heard about this at all, and they'll think that it's a TikTok trend or something you read on Facebook, or because your labs are normal that they missed it. So, or that they can't have it. So keep in mind that it may be certainly a cause of what's going on, and this may be a little bit of a tricky part to get some treatment for. Certainly there are lots of things that can help, both in the herbal field and in the medication field. We're not here to give advice or to help you to diagnose yourself. We're here to help you to figure out what are other things that should be considered. And so in that, we want to make sure that you're informed, educated, but we can tell you exactly what to do. And so working with a practitioner that doesn't understand it and using some of, those questions when you call to book in with someone, just be like, do you have anyone with this? Do you have any experience with this? That can be really helpful, especially if you're finding that you're seeing people about your bloating and the things aren't helping or not changing anything. This definitely is a place to look. And certainly if there are other things that have gone on in your life at the same time. So lots of stress, lots of other things going on, lots of comorbidities or other diagnoses. Certainly this rises higher to the top of the list of things to be investigated. So sometimes bloating isn't about what you ate. Another episode on that. It's about activating, in this case, your immune system. Sometimes some of the other cases, it's actually a functional or structural problem. But you can see that bloating is super easy. And that's why we've dedicated this whole first season just to helping you to understand different things that might be contributing and causing to your bloating. And so you can always go back to the YouTube channel or a webpage to get more information and insight and find out, put in your own symptoms, see which podcasts talk about the symptoms that you're experiencing to see, what should your diagnosis look like. Don't give up. There are practitioners that do know stuff. Even if it feels like you hit a wall, there is a reason for your bloating, and it's just about working through what's going on. Any parting words?
Better gut changes everything.
Thank you for joining Team Gut Girls. Like, follow, subscribe, and share a podcast with friends you think will want to know more about their gut. You can also visit us at teamgutgirls.com for show transcripts and more information, because better gut health changes everything. See you next time.